Hello, my name is Mike Willett at the Intertribal Council of Michigan's National Native Network. Welcome to the National Native Network webinar series on cancer risk reduction in Indian country. This webinar is on our Traditional Food Toolkit. This technical assistance webinar is being hosted by the National Native Network, which offers technical assistance and resources for commercial tobacco prevention and control throughout Indian country and the Indian Health Service Clinical Support Center. Your presenter today is Tammi Missner. Tammi serves as the health educator with tobacco policy at the Southeast Alaska Rural Health Consortium. Tammi has a Bachelor of Arts from the University of Alaska Southeast in Juneau, Alaska, with her major area of study in elementary education awarded in 1998. She also received her Rural Nutrition Certificate from the University of Alaska Fairbanks, received in 2011, and currently holds her Alaska Teaching Certificate from the state of Alaska. Tammi is a Tlingit from Rangel, Alaska. She was raised and continues to hunt, harvest, and eat traditional foods. Prior to her current position, she was the Rangel Surge Traditional Foods Coordinator. She had organized and taught how to harvest and prepare traditional foods in Alaska. She continues to learn and gain knowledge through individuals, elders, and higher education systems. We are pleased to offer continuing education credits for participants in this webinar. No commercial interest support was used to fund this activity. This activity is designated one contact hour for nurses. To obtain a certificate for continuing education, you must be registered for the course, participate in the webinar in its entirety, and submit a completed post-webinar survey. By the end of this webinar, participants will be able to identify patterns of traditional foods use, identify their role in improving health, identify ways to promote traditional food activities, share traditional foods, and share the Traditional Foods Resource Guide Toolkit. If you have any questions, please type your questions into the question box on the lower right-hand side of your screen. Questions will be answered during the last few minutes of the webinar. At this time, I would like to present to you Tammi Missner. And Tammi, I will hand over controls to you right now.
Thank you. Welcome, everyone. I think we're in the process. Welcome. Today, like Mike said, we are going to be talking about traditional foods, the Traditional Foods Resource Guide, and food as a way of life. And again, I'm Tammi Missner, and I work for SEARCH, Southeast Alaska Regional Health Consortium, and I'm a health educator here in Southeast Alaska. And, okay. Oops. Okay. So the mission of the National Native Network, NNN, is to enhance the quality and performance of public health systems to reduce commercial tobacco-related illnesses and cancer disparities among American Indian and Alaska Native populations. The National Native Network partners are listed right here. So we are a network of tribes, tribal organizations, community members, federal, state, and local partners. The network is administrated by the Intertribal Council of Michigan and led by a board of 4 tribal agencies. Each agency works within their respective regions and brings that perspective and knowledge to the national platform of the network. Here's a wonderful picture of me. So again, my name is Tammi Missner. My Tlingit name is Kashau Duati. I'm Nanyai Ayahat, Deshitan Yadi Ayahat, Chaknak Satsati, and Stikking Kwan Ayahat. So what I said was, My Tlingit name, as you can see there, is Kakshau-Duati. It means killer whale who finds food for the group. I was adopted into the Nanya-Ai clan here in Rangel, Alaska. My mom is non-native, so we go matrilineal. So my dad is Deshiton, which is originally from Angoon. I am of the Eagle moiety, and I have been asked today to present on the traditional foods resource guide that we created. I researched into 4 IHS regions to find more information than was provided by my contacts. So I did have assistance from people who are listed when we get to the very end of the traditional foods guide. Their names will be in that booklet or the PDF that you can download. I'm a Tlingit member of the Rangel Cooperative Association in Rangel, Alaska. There are 229 tribes, federally recognized tribes in Alaska. And as a customary tradition, I'm only allowed to talk of my tribal traditions, but as a health educator of Southeast Alaska, the Regional Health Consortium, at times I'm required to share information that relates to Alaska Natives in Alaska and American Indians. So if I say anything that might offend you, I apologize ahead of time. So, moving on. Here's Alaska, and here is where I am located. There is Rangel, in the little town in Southeast Alaska. So this is my hometown. I'm the 3rd generation born here, but my family came from through Klawock and also Angoon. So, and for those of you who don't know, we only have one reservation in Alaska, and that is Metlakatla, which is below Ketchikan on this map. And here is my hometown of Rangel. And on the top part below the wing of the plane, you can see some, it looks like sand. That is the Stickeen River mouth, the mouth of the Stickeen, and we have a cabin up there. So we have a couple different ecosystems near Rangel. We have the ocean, and then we have the Stickeen River, which is really close. My husband and I have raised 2 kids here, and we have approximately about 2,000 people in town, which I'm probably related to most of them. So as Mike stated, we have our presentation objectives are to identify patterns of traditional use, identify the role, their role in improving health, identify ways to promote traditional food activities, and to share the traditional foods toolkit guide. Now, we focused on 4 IHS areas, which were Alaska, California, the Great Plains, and Portland. The Great Plains IHS area includes North Dakota, South Dakota, Nebraska, and Iowa. And Portland IHS area includes Washington, Oregon, and Idaho. For those of you who don't know, IHS, or the Indian Health Service, is a division of the Health and Human Services Division. It is responsible for providing health services to federally recognized tribes of American Indians and Alaska Natives. How important traditional foods are in our culture and for our health? They are very important. Cancer, diabetes, and obesity are 3 chronic diseases higher in Alaska Natives and American Natives. So the first thing I'm going to talk about is Alaska traditional food use patterns. As you can see, this is a poster which is you can order through when we get to the guide that we made. You can order it through the guide. It has the information. This is traditional foods guide poster. It's actually kind of a large poster to hang on your wall. Again, you'll notice it's a circle. There's a reason I use the circle throughout my discussion, because everything follows the circle in traditional ways, as you will follow along in Native cultures, we use a circle for the seasons, for the circle of life, for patterns, that kind of thing. So as you can see on here, there's summer, spring, winter, fall, and under these fall things that you can collect or harvest or hunt in each of these seasons. Our ancestors ate when they were hungry, and they didn't eat processed foods, which many of you know. They drank a lot of water and were physically active because they had to go out and harvest and hunt their own food, which led to hardly any heart disease, diabetes, or high blood pressure because they were always moving and eating non-processed foods. For us in Alaska, the winter time was, as you can see, in summer and spring on this, that was a really busy time. We were collecting a lot of things that we were going to use in the fall and in the winter. As you can notice in the blue, in the winter, there wasn't a lot to harvest. We did do some hunting and a few gathering, but that was more of a time of potlatch and storytelling and sharing meals and telling stories. So now to the next screen. So as I was doing my research for the traditional foods toolkit guide, as you can see, California also has a circle, and they actually go by north, south, east, west. But if you look under each of those, and I hope you can read it, if not, under north it says a good source of protein, and it lists like salmon, trout, deer, what they harvest during that time or what is available under proteins. In the West, they harvest, it talks about what drinks that they collect or they harvest, and the South is starchy plants that they would collect and or grow, and in the East, this one is gathered plants and medicine. So what I'm really trying to show here is that it is a circle, and in the center you will notice that it's an acorn because their central, from what I found, was again is they centralized on the acorn. Okay, moving on to the next slide. So here's the acorn. This is one of the many acorns that they have. It is unique because it's really high in fat and protein, and they use it in a lot of different things. It's really high in vitamin A and vitamin C and amino acids. They eat it make it into mush, bread, soup. It's a plant-based food, but it's really high in protein, which is actually really great. It also contains a lot of minerals and fiber. So I'm just kind of touching base on the 4 different IHS areas. So now we're moving on from California to the Great Plains. Now, the Great Plains, again, like California and Alaska, have many different tribes. I did only choose one tribe to focus on right now, which is the Lakota, and they're nomadic, which means that they move around. Some other tribes are agricultural, but for this choice I used just the Lakota, which is nomadic. Again, you'll find it in a circle, and it goes by the months, and it also goes, you can see spring, summer, fall, and it shows what they harvest in those times. As you can see in the middle of the circle is the different things they really focus on that they use. I chose the buffalo because that seemed, when I was doing my research, was a large part of the Lakota, I guess, traditional foods, so what they really focused on. So here is the buffalo, and it is high in nutrient-dense food. Oops, I'm sorry, I hit the wrong button. Let me see if I can go back. I can't go, oh yeah, I did. Sorry, technical difficulties. So the buffalo, it It was great because it was dense food. Of course, it was used for other things such as, you know, the hide. I mean, traditionally, everything was basically used off of all the animals that we hunted. I mean, in every tribe that I found, including Alaska, we used every part of every animal for one type of thing or another. Nothing was wasted, basically. It's full of good nutrition, the buffalo is. It's a great source of protein, low in fats. It has many vitamins such as B12 and B6. It's high in minerals such as iron and zinc. Buffalo has very little fats, and it is, when you cook it, it doesn't shrink very much, I believe due to the fact that there's not a lot of fat. So anyway, the agricultural the other tribes that are agricultural, they would actually trade with the nomadic, with like the Lakota, for meat. So if there was farming, if you were a farmer, then you would trade things such as corn and things like that for meats with the nomadic people. Okay, so now we're on to the Portland traditional food use pattern. And again, this is a circle, as you can see, and it has the months. And if you didn't notice, there is in the middle, there's a net. There's a traditional fishing where they would spear the fish. And there obviously is fish surrounding the second part of the circle and some other animals. But basically, this is from the Columbian Basin located in Washington, one of the three IHS states in that IHS Portland area, being Columbia Basin being in Portland. So this is seasonal, also again a circle, also again the main focus here is the fish. If you didn't notice, they have a lot of fish. Those of us on the West Coast eat a lot of fish. So their focus was the fish and the salmon. And here is a king salmon. I do have to admit this king salmon was only about 20 pounds, but I kind of widened him so he looked really big. So fish are extremely high in omega-3. They are wonderful to eat. Of course, we have many different kind of fish in Alaska. Salmon, we have sockeye, we have king, we have loads of different kinds. But they're an excellent source of protein also. They're high in vitamin A. They're essential food for, of course, for the Portland area, but also in Alaska. We bake them, grill them, fry them, boil them, steam them, can them. They can be smoked, they can be brined, they can be dried into strips, and they are an excellent resource for us in the Pacific Northwest, and we do a lot of trading for fish. So moving on to the next one. So those are we're still in the traditional use patterns, but this is the loss. These are some of the things that we have found of the loss of the traditional food system. Now, I wish I could have found something that would have broken this circle, but I was trying to follow the same format. These are some of the things that affect our traditional food systems. A lack of land, lack of nutrient soil, lack of limits to harvesting animals, loss of pure water sources, loss of rights to harvest, limited planting gathering places, depleted salmon runs, loss of knowledge. Gosh, there's a whole bunch of others. In fact, if you would write some down as you're taking this, I know all of you are from different IHS areas. If you can think of any other ways that we have lost or are limited in our traditional foods, gathering, hunting, those kind of things, I would love to hear from you what else has caused a loss of our traditional foods. So these are some of the things that we're challenged with. Moving on to the next screen. Because of the loss of traditional foods, not only in what I just explained as in land, limits of harvesting, water, that kind of thing, in tribes and in the native culture, we try to keep things in balance. And because of our loss of traditional foods, whether it be loss of knowledge or loss of rights, it's caused us to be out of balance. So cancer and diabetes and obesity have become heavier, which means that they have become greater. The loss of traditional foods and the loss of culture and traditions has lightened. In other words, not a lot of people know these things anymore or do these kind of things. So we're not in balance right now. For the first time in Native people's history, we are drinking a lot more of sugary drinks or alcohol. We're eating processed meat with added fat and less protein. We have access and consume, we have access and consume fruits and vegetables which are poor. They're not the highly dense, like for example in Alaska, all of our vegetables and fruit are sent up on the barge, which means that they send them up, they're either genetically altered, or they send them up before they've even been ripened, and therefore we don't have the nutrients coming out of them. We might think we're eating well, but we're not. Grains are highly processed and often fried. Because of our loss of balance, we are starting to lose some of our traditional stories, traditional games, language. We're losing our communities. We used to gather a lot, and that's become less and less. Of course, our poor nutrition, our loss of culture. Some places have more culture than others, but we are seeing a loss of culture, a real lack of exercise, a loss of connections, meaning, gathering and hunting we did as a group. We would do things together, and we're losing those connections, and we're eating a lot of processed foods. Okay, moving on. Okay, common types, as you can read here, I'm just going to let you read over them. Common types of cancers among American Indians and Alaskan Natives. Of course, lung cancer is the highest cancer diagnosed for Alaskan Natives. In 2013, cancer was the leading cause of death in Alaska, accounting for 25.3% of all deaths. So that's pretty high. So cancer death rates, this is really interesting. This is from 2014. If you look at the first three columns, Northern Plains, Southern Plains, and Alaska, this is the rate of 100,000 population. Look at the rate. The blue is Alaska, American Indians, Alaska Natives. Look at how high our level is compared to non-natives. I mean, look at the difference in the amount of our cancer deaths. There have been more cancer deaths annually in Alaska than the next common cause of death, heart disease, since 1993, when cancer surpassed heart disease as the most common death in Alaska. The top leading causes of death are cancer, heart disease, and unintentional injuries. A little over half of the deaths, 52% in Alaska, is caused by, actually, I'm sorry, cancer itself in Alaska causes 24% of Alaska's death. Of course, again, like reiterating the last slide, lung cancer is the highest in Alaska. And 28% of that is from people who use tobacco. Moving on to the next slide. Diabetes. I briefly wanted to touch on diabetes because this is, a big part. Look at the drastic difference. From 1995 to 2010, there was a 136% increase in diabetes. The percentage of Alaska adults who are obese has steadily increased over the past 2 decades. It's incredible. It's never too late to change and improve health. We can do this. Diabetes can be prevented. Family and community efforts are key in this, though. Getting back our traditional ways, getting back to communities, supporting each other. These are very important in getting back our health. Right here, this screen for diabetes was basically to show you, this is age 20 and older, age adjusted for 20 and older, diagnosed with diabetes from 2010 to 2012. 15.9% of American Indians and Alaska Natives, and I'm sure it's higher now, but that's quite an alarming number of people who have been diagnosed. This is not prediabetes, this is diabetes. So just want to point that out. This goes hand in hand with obesity. As you can see here, it goes from 1963 to 2008. Notice the green, 12 to 19-year-olds. Look at 2000. We were about 15% of our 12 to 19-year-olds, at 15% among our children of the U.S. were obese. Now it is about 18% in 2008, and I'm guaranteeing you it's probably over 20 now. The important thing is that it's a decrease in physical activity. We need to get moving. As you've always heard, we need to decrease our consumption of processed foods and sugary beverages. This can all be done with traditional foods. Being overweight and obese is a huge, major health concern because it can be one of the leading causes that leads to diabetes. I love this quote. I'll let you read it. It says, I'm going to read it also. Traditional foods improve health, where this is objective 2. Our ancestors left us their example of good nutrition and superior health. They taught us that food is a gift from the Creator and a spiritual medicine to be eaten respectfully and in balance. To come into balance, we need to grow, harvest, and eat more traditional foods. Then we have to have a more nutritious diet. Therefore, we'll be healthier in mind, body, and spirit. So again, here is Alaska, and this is just a brief outline of what we have in each of, it's a better screen to see what we harvest in each. Now, of course, there's a lot more than this. I just wanted to show you this slide before I go into some things that we do in Alaska. So the next screen is the Alaskan wild berries, blueberries. These are rich in antioxidants. They contain the highest antioxidants in blueberries. They believe because of the fact that they grow in a harsher environment. They are a great source of vitamin C. They're great in fiber. Of course, they're free to go pick as many as you want. They're great to make jelly, sauce, jam, relish, pies, puddings, all of those. And they're free. You can go out and harvest as much as you want. But they're a great source of antioxidants, and I harvest a lot of them every year. Okay, well, wild game. This is me when I was about 6. And yes, I'm holding dead animals. All my pictures when I was young was holding dead animals. Wild game is really important because wild game, they eat the nutrient plants and then we eat them, which means that we're getting good nutrition. It's not cows being fed, you know, all sorts of stuff or those chicken farms that you see, you know. These animals are eating wild things with wild plants, and then we are intaking their meat, which we know is completely healthy. So food is the center of a majority of our traditions. And it's really important because not only are we physically active when we hunt, but we usually do it with the family, which is a great connection. We hunt together or in groups, and then process the food together. Here is a moose. This is my daughter. She shot this when she was 10, and she is 19 now. But this is an excellent source of protein and iron. Again, it's kind of like the buffalo. It's low in saturated fat, low in sodium. It's high in protein and high in iron. It can be frozen. It can be boiled, grilled, fried, dried. We eat the heart, the liver, the nose, the tongue. They can all be eaten. We use a lot of almost everything off of here, off of the moose. So good source of protein and iron. From the ocean, here's an example of herring eggs. This is my daughter eating raw herring eggs off the branch, and they are high in protein and high in iron. Moving kind of fast, I'm sorry. A lot of information. Devil's Club. The search logo is the Devil's Club. The reason is because not only is it medicinal and a great, wonderful plant, but it is also spiritual for us. And Search's logo is the Devil's Club because it treats a huge amount of ailments. Some of them are listed here, such as internal infections, tuberculosis. The properties have antibacterial, antifungal, antiviral. Let's see, it's also used for arthritis, the flu. The berries can be pounded and rubbed into your hair for lice and dandruff. Ash can be used for burns. And the spiritual use, we hang Devil's Club above the doors to prevent against bad spirits. So Devil's Club, if you have a chance, Google it. It has a lot of different things that is used, and it is a wonderful plant here in Alaska. Okay, moving on, I wanted to talk a little bit about how it also includes how traditional foods. I gave some examples of the things that we use, moose, herring eggs, those kind of things. But also, traditional foods can play an important role in improving the health of Alaskan Natives and American people by teaching others, by fish camp, by sharing, by having mini teaching lessons. Harvesting traditional foods or growing gardens keeps people active and provides them with better nutrition choices that are not full of refined sugar, additives, and empty calories. If we're doing, for example, if we're doing a fish camp or some small event, it helps share the traditional knowledge. For example, here we have an elder. The gentleman who's showing how to cut the fish is my father. The person next to him who is an elder, and it was her first time cutting and filleting a fish. So the education is moving on, even though it can be to older people or to younger people. We need to share what we know so we can keep it alive. And during this whole process, we're sharing stories. We're sharing the kids in the background. We're sharing information and stories. Not only were we sharing and teaching elders, we're sharing the youth. All of these children were, and they look young, all the way up to elders, were taught how to distinguish between the fish, taught how to tell which fish was what, sockeye, king salmon, humpies, and then they were taught how to cut the fish and how to fillet the fish, which is sharing knowledge, which we need to keep alive in order for our traditional foods, food ways and knowledge to be shared. Also, our youth, what we can also do is share. The youth can teach others. This is my daughter in the pink shirt, and the orange shirt is her cousin, and my daughter is showing her how to string hooligan. And so my daughter was taught, and then what we do is have the children teach younger children in front of us. So you You learn, you teach, you show, and that way you get the whole package, and it's easier to remember. Modeling and teaching are such an integral part of traditional foods and preserving it, but also it teaches our children where the food is coming from and why it's good and how we've used it and for generations. For example, hooligan have been dried and used for generations. These are called hooligan. They were also called candlefish because they're 30% oil, and they were sold to gold rush people, and they could use them as like a first nutrition bar because they kept really well, or you could use them as a light. You could light the tail and they would burn as a candle. So keeping the youth involved is very important, but teaching and modeling and sharing is very, very important. Another thing is that while you're harvesting and while you're gathering these foods, this is an example we had at fish camp, it's to also have fun. And they're exercising. They're swimming in the water. They have life jackets on. You can see some people are fishing. It's incredible. The exercise that they get, you know, when we're together, we have no cell phones. We play kickball. We share stories. We do traditional games. We interact with each other. The most important thing is that from 3-year-olds to 70-year-olds can interact and gain a connection together around these foods that we harvest and then reprocess. And it also shows the importance of what our food does, not only for eating, but for our souls, and also for connecting with other people, whether it be our family or our family for a weekend. Maybe it's a group of people that families working together. This is an example of a kid that was helping. These two did not know each other at the beginning of fish camp, and it was incredible because of the connections. And I had to show this because he was helping somebody out of the water. It's teaching our values at the same time with traditional foods. It's not just strictly one thing. As if you're in a tribe, you know that everything is connected. Everything has a purpose. And right here, this is a great example of a teaching moment where he learned to help. Had it been alone, he might not have stuck his hand out to help her. But that was taught and modeled by all of us. This is really important. I know some of you don't have things like we do in Alaska where we can go out and harvest in the forest, because we have a lot of national forests here, which we can go in and harvest all of wild berries and hunt and fish. But this is my mother's garden up the Stickeen River, and she also obviously grows really well. She's a master gardener. And harvesting of traditional foods can come from plants, wild. It can become from grown food, land animals, water animals. You can, when you're doing a garden, you're bending, you're weeding, you're using all sorts of muscles. You're growing and harvesting, and you're sharing. I mean, this garden feeds a lot of people, not just my parents who had this garden. And what I'd like to share is that, when you harvest, you walk, you hike, you use your arms, your legs, you bend, you reach, you stretch. You're using your whole body. Then once you've harvested, you process your take or your harvest. Here you are. And this happens with friends, family, your tribe. It includes working with other people. And then you eat the bounty of the land and the water, whatever it gave to you, and you share meals with your community or your friends or your family, and it creates that support. You hear stories, you share stories, you teach lessons, and you eat a healthy meal together. Very important. The third objective is promoting traditional foods and reducing chronic diseases. This is restoring the balance. The more, as you noticed from the previous slide, which you'll have, you can load this later, is when you, in order to reduce cancer and obesity and diabetes, you have to make the green more accessible. Traditional foods, physical activity, and a nutrient diet. Through traditional foods, you have activity and you get good nutrition. So that balances the cancer, the obesity. It reduces all of those. Obesity and diabetes are reduced by physical activity and the nutrient food, and it also reduces cancer because we know eating non-processed foods also helps in reducing cancer. Very important to keep balance. This goes all the way back to the circle of life, the circle keeping balance. This next slide is ways to promote traditional foods. I'm going to start on the right, which is cultural traditions. Here is my father, who is showing the guy in the orange from Cake how to harvest hooligan. So he, not only is he showing someone younger, but he's showing someone else from another town, a village, how to harvest. So it's sharing those cultural traditions with everyone, with your tribe, with your family, with your friends. How do you harvest and keep healthy? Below that, sharing knowledge. This is my father showing my younger daughter how to tie knots. This is great because you need to share. You need to have those times one-on-one where you can share your information. It can be even a child, as we did earlier, my daughter showing her niece how to do something. It's that sharing of knowledge. You don't have to be an elder to share. It is important to know how to do it correctly, so please do get advice from your elders. Tribal up here, tribal or family gatherings. This is my grandma on the end, who's 91, my aunt, and my dad. And this is the bounty of crab and shrimp. And this is what we do. This is our meal. And we get together and we tell stories and we talk about politics, or we talk about traditions and share stories. And this is what we do on a regular basis, at least once a week. Also, ways to promote traditional foods is in hospitals and clinics. Our hospitals really need to start adding more traditional foods into their menu. I know Alaska Native Medical Center in Anchorage is really including traditional foods because a lot of our natives that come from the villages, it is different for us. If we eat traditional foods and then eat Taco Bell or food that is not traditional, it causes a lot of stomach problems for us. Probably the opposite happens for people who go to villages and eat a traditional food, just traditional foods, because it's a different dietary nutrition and your system has to get used to it. But it's a really great way to start with the hospitals and clinics. The fourth objective, of course, is this is the front of our National Native Network Traditional Foods Resource Guide. This is what you will be able to find at the very end. We'll have a link to it. We created this guide again in 4 IHS areas. There's some great books, websites, posters, flyers in this guide. And we hope that the Traditional Foods Resource Guide will help you start thinking about how you can as an individual, as a tribal member, as a leader in your tribal community, or through your work, whatever you do, to promote and to make changes towards eating, growing, harvesting, and gathering traditional foods for all the reasons I've just talked about throughout this PowerPoint. There are many good programs that people have created, and the key is to make connections with those people and how they're working in this field or in your area, and tap into them. Use them as a resource. How can you get this? What my takeaway is I encourage you to share what you've learned today and then look for ways that you can promote traditional foods. It may just be with it. Your first step may just be you and your family. Then it may be you and your friends. Then it may be you and, say, your tribe. Then your tribal community as a whole. Then, I mean, snowball out. take it slowly, but definitely start making changes. The only way we're going to keep our traditional foods and make our people healthier is to do this. I mean, we've got to get away from processed foods and refined sugars and eating healthy. But the thing I'm getting close to the end here. What I'm hoping is that we can continue to update this resource guide, and I'm happy, I'll have my email address here, and I'm happy to receive emails from you with websites, books, etc. Anything you'd like to share with me, I kind of will be the keeper, if you would like, of the information, and when and if we do update this Traditional Foods Resource Guide Toolkit, I would be happy to add those in later, but I will be the keeper. So if you would like to email me books in your area, websites, that kind of thing, please share with me, because the National Native Network is a great place to store this information, have a central location. The Traditional Food Guide, we are hoping is, like I said, is a working document. Everything is in here, but we're hoping it's a starting point for you to start talking about this and also to start sharing. So the next thing is a discussion, but as we discuss, I'm going to turn it back over to Mike, but as we're discussing, notice circle, round table, kind of going with the flow of our tradition. The next thing is here's the National Native Network, and talks about and you guys will all have this if you would download the this PowerPoint. And the next one is a wonderful picture of me. And Gunashish, thank you for listening today. I'm sorry it was so short. I love to talk about traditional foods, and I could go on for hours. So thank you again, Gunashish. And here is the link that you can reach Keep It Sacred, and that you just click on that and it will bring you straight to the resource guide, Traditional Foods Resource Guide that we created, and you can download. So in this, as you can see, there's these things up here are included in on that site. So I'm going to turn it back over to Mike, and please ask any questions. Again, if I go back, my email address is right here. Ready to go. Oh, it's not going to let me go back. If you need to get a hold of me, I can get your email. Oh, there we go. There's my email address. If you would like to email me, like I said, any books you have, any kind of programs, please let me know. I'll keep it as an archive, and I'd be happy to share it and update, hopefully later on, this toolkit. So I'm turning it back over to Mike. If you have any questions, I'd be happy to answer if I can. Thank you. Thank you for attending today.
Thank you very much, Tammy. Appreciate the time that you took today. Let me see here. Somebody had asked if they're going to be, if the viewing is going to be available later. We are going to archive the webinar. We did have over 200 people registered for the webinar today, but unfortunately GoToWebinar only allowed us 101 people to actually attend it. So we had, I'm sure folks had seen the pop-up come up on my screen saying that the webinar was full. So we will be archiving the webinar, and we will put it up on the keepitsacred.org website here in a little bit. So, and it'll be actually right here on the Traditional Foods Resource Guide page. That's right here. Let me see here. And one other question. Are there any tribally owned or operated traditional foods programs in Alaska that are accessible to tribal members?
Okay, so there are a few in the website area of the guide for search. There is a contact number for traditional foods. Her name is Clara Gray. from Search, and she would be happy to talk to you about the Traditional Foods Program. I do know that we're trying to start some more. Our funding ran out a few years ago, but I know we are trying to get a few more startups here in Southeast Alaska of programs. But I do know that there's some unorganized ones. For example, I do some like mini fish camps and events, you know, digging clams and those kind of things personally. So I do mini events on my own because I really want to share the information. So to answer your question, yes, there are, but I don't know all of them. So I can hook you up if you want to email me. I can share as much information as I can, and definitely look in the resource guide, please.
And again, the resource guide is available right now on keepitsacred.org. All you got to do is just click on the resources tab on the left side, and it's going to be the next subpage on the resources tab on the left side of the menu there. We're waiting around to see if anybody else has any other questions here. We'll wait another couple of minutes, or another minute anyways, if anybody else has any questions that pop up.
Okay, well, Mike, do we have another one?
Yep. It says, Lake Tribes translate, well, to what do you do in Alaska? Do the water teachings of Great Lakes tribes translate well to what you do in Alaska?
Okay, I
think that what they're asking is, are there things that are applicable to what you're doing in Alaska that would work well with the Great Lakes?
Absolutely, absolutely. I'm going to tell you that all of this, my background is in teaching, so all of these things that we do, and including in Alaska, which I've done a lot of different things, and so have a lot of other people that I can connect you with. But yes, they do translate. You would have to adapt them and change them, of course, to what you want to teach, but they are applicable. You can do mini events, you can do a 5-day event, those kind of things. Yes, please contact me. I'd be happy to talk you through it. I'd be happy to share the information that I have. On the website, there's some good information, but if you want particulars on who to contact or specifics, please contact me or call me, email me, and I can give you my phone number, and I'd be happy to walk you through that. Yes, every IHS area is applicable. You can change the dynamics a little and use the same kind of format. So yes.
Excellent. Then we have another question that says, for the Portland area, what tribes did you speak with or resources did you use for your information to compile the resource guide? Do you have any suggestions on how to get our tribes more traditional foods friendly for the Native community and elders?
I believe we focused on the Washington area, and I'm sorry, the name eludes me at this point of the person that was our contact person. And then part of it was I did research on my alone also, because sometimes people don't respond because we're really busy people. So I would like to say, yes, her name is in the guide if you want to contact her, and it also lists her organization that you can contact her at. What was the second part of that question, Mike?
Let me see here. Do you have any suggestions on how to get our tribes more traditional foods friendly for the community?
Well, yeah. Okay. My suggestion would be to start small. So if you are interested, would be to possibly maybe have a sit down with your elders and just talk to them. It can be, make it an invite to your tribal members or local members. Maybe you're not, maybe you're on a reservation or maybe you're not. and maybe just put it out there. You're looking for tribal members who are interested, elders who are interested in sharing information. And then what I would do, the next step I would do is say, okay, choose one of those activities and then see if the tribe will sponsor you or would provide some, someone to coordinate it. And then get people involved. I think it starts with the children and the parents. If you can get a buy-in with the children and the parents, they'll learn it and they'll start using it at home, and therefore then it'll spread to all of the tribes using, because then it'll spread farther out. But start small, then go big. But definitely ask for assistance from elders. I hope that answered the question.
Excellent, Tammy. Let me see here. Somebody else had a question. They said, thank you for the presentation and the AAMC menu shout out. So far that's what we've got for questions. Just going to wait another second here, see if anybody else pops up. Did you have anything that you wanted to add in the meantime, Tammy?
Yeah, there was a couple really good things that I found, like for Alaska, there's YouTube videos on the store outside your door, which is really neat. And that also goes back to AA and THC. They promote that, and it talks about how to use traditional foods, and they do have cooking lessons, that kind of thing. So if you want an example of how it can progress from individualized into something a little larger, that would be a good thing to check. I mean, if you're working in the health field, maybe that's your ultimate goal, is to have a store outside your door for your IHS area or your tribe, or that kind of thing. Maybe your goal is, and they have wonderful posters that I found from the Great Plains, posters on traditional foods and how they used them, and what is traditional foods, what was traditional foods. So use the resources you have and add to it. Don't be afraid to ask. The biggest thing is don't be afraid to ask. You don't know unless you ask. And then don't be afraid to share your knowledge. It's all about sharing knowledge to make sure that we understand, and then that way we can pay it forward and share with our children and share with others, so that we understand, and to teach that the healthiest eating is what we grow, we harvest, and is wild. And that's the most important takeaway, is that it is less processed, less sugar, less food, drink water, eat off the land.
Excellent. Well, thank you so much, Tammy. Looks like we're getting close here to 4 o'clock here Eastern time. So we'll go ahead and wrap it up here. We want to remind everybody that that everything that we had talked about today is going to be on keepitsacred.org on our website here. The URL is at the bottom of the slide that you've got there. It's keepitsacred.itcmi.org/traditional-foods-resource-guide. And also, we'll be sending out a brief survey monkey evaluation by email, which should hopefully go out tomorrow. If you're planning to obtain CEUs for this webinar, complete the evaluation survey in its entirety within the next week, and we'll go ahead and get that sent out for you. Also, please visit our website, keepitsacred.org. Follow us on Twitter at keepitsacred, and you can like us on Facebook at facebook.com/keepitsacred. You can also find this and other technical assistance webinars, as well as many other cancer and commercial tobacco prevention resources for tribes and tribal organizations on our website and social media. So until next time, thank you very much for joining, and we hope you have yourselves a wonderful day. Thank you.